Good morning, everyone. Just letting you know, we're waiting a couple minutes for folks to come into the room. So we've opened up the webinar, so we'll just wait just another minute or two for folks as they're starting to come in before we start the webinar promptly at 9:30. And good morning, everyone. I just wanted to give it another 30 seconds as we see folks are coming into our webinar. Okay, we'll go ahead and get started. Good morning, everyone, and happy Friday. I'm Connie Nakano. I'm Communications Director for Department of Aging. Thank you for joining us today. We will be covering RSV, flu, and COVID-19 impacts on older adults. Next slide, please. So we've got 30 minutes with everyone today, and we've got a packed agenda. Next slide. I don't see it forwarding. But on our agenda, we're going to go through a quick introduction. You'll hear, logistics first, housekeeping. Just wanted to remind everyone, participants are all muted during the webinar. We do have closed captioning available, so you can access that by clicking on the icon at the bottom of your Zoom screen. And also this presentation will be recorded and it's going to be archived on our CDA YouTube channel. Next screen. I believe now we're on to the agenda. So you'll first hear from our director, Susan DeMorris. Then we'll hear some information from Dr. Tomás Aragón. And then we'll go over briefly about an outreach kit that we have as resources for everyone that we'd like to ask for you to share out with the consumers that you serve. So let's get to our welcome. I'd like to introduce our director, Susan DeMorris.
Thank you, Connie, and good morning and welcome to everyone who's joining us on very short notice. We're so thrilled that we are able to bring this information to you at the start of the month of December, when we know that many of you will be gathering with families and family members and friends, colleagues, to celebrate and share festivities, religious, cultural, and end-of-year events. And it's very important that we bring to you information as it's unfolding in our state and across our nation. We are just honored to have with us today California's Director of Public Health and our state's Chief Public Health Officer, Dr. Tomás Aragón, who will be sharing up-to-the-minute information with all of us as we enter the month of December, and we maintain our own health and safety and that of all who we care for and love. Dr. Aragón, we turn it over to you, and thank you so much for making yourself available to this group.
Thank you very much. Okay, I'm just I had to change the shade because I had the sun in my face. I want to make sure that it wasn't distracting. So let me go ahead. I'm going to put up my slides and then we'll get started. Good morning, everyone. Thank you for spending this time with me this morning to give you an update on the respiratory viruses that are circulating. This will have a strong focus on COVID. I will mention RSV and influenza as well because they're all impacting us. And in fact, at this time of year, we have all kinds of viruses impacting us. We tend to talk about the viruses that we can do something about, but the truth is that there's a lot of viruses that are circulating at this time of year, impacting all ages. And so, what we do know is that people who are older are impacted more than other folks. I'm going to start by just giving you some brief background because, you know, we are now, you know, we've had this pandemic since January of 2020. A lot of things have happened. And just by looking back a little bit, it helps us to understand how we can take all this knowledge. We have learned a tremendous amount about what we can do to protect ourselves. So this right here is just the cumulative mortality rate or death rate from COVID comparing different countries across the world, okay? And what you will see is that there is a big variability in the cumulative death rate. And you'll see, for example, countries like South Korea, Japan, Singapore, Australia, New Zealand, they've done much better than these other countries. And as you go up, you'll see that the United States has among the highest cumulative mortality, which means that we can actually do better. And that's what we're going to talk about. What can we do better? And we know it can make a difference because that's what this slide is telling us. It's telling us that we do not have to have the morbidity and mortality that's impacting that occurs from COVID. This is an example here of those who've completed their primary series for vaccination. You'll see if you go, it's hard to see, but there's an orange line on the left-hand side. That's the United States. The United States started off really fast, but you'll see ended up really not doing as well as other countries. So we're also behind in just getting people vaccinated as well, and that's contributing to that increased mortality that I just showed you in the other slide. And that's one of the primary messages is that these vaccines work, they save lives. And what I'm going to emphasize as we go through the slides is that, however, unfortunately, this virus is tricky. It figures out how to evade our immune system, and our immunity wanes. So the combination of those two, the waning of immunity and the vaccine and the virus getting smarter, means that we have to stay up to date with our boosters. And there we're not doing as good a job. Here it is, example for boosters comparing the United States to other countries, and you'll see that we're at the bottom. Again, an opportunity for us as a country to do better. This is from the CDC. I pulled this down yesterday, in which you can see hospitalizations are going up across the country. And this is true also in California. Right now, hospitalizations are our best indicator of what's happening with COVID, because it's an indicator that we can measure with a lot of precision. And so that's one of the reasons why we're concerned, and we're bringing this up now. And you'll see what this is going to mean for you. Now, the CDC has two different ways of sharing information with us, how much COVID is in your community. The one on the left-hand side is called community levels. Community levels is based primarily on hospitalizations. It gives a lot of weight to hospitalizations and then some infections. On the right-hand side is community transmission. That focuses on test positivity and also case rates. Now, one of the challenges we have with not with test positivity, but one of the challenges we have with case rates is that we know it's an underestimate because a lot of people are now doing home testing. So this doesn't end up in our surveillance system. So whatever amount of, whatever case rate we are able to measure, the actual transmission in the community is probably at least 5 times that. So when you look at this curve, the way that I think about it is that if it's orange, it's probably really red. If it's yellow, it's probably really orange. If it's blue, it's probably really yellow. Blue is the best. So you can see that there really is a lot of transmission. Now the healthcare settings are the ones that focus on the map on the right-hand side. That's why we continue to have required masking in healthcare facilities and in skilled nursing facilities and in other high-risk settings. It's because of the map on the right-hand side. The general public is generally going to be looking on the map on the left-hand side. I'm showing this to you just to empower you with the information so that you can it helps you sort of to consume the information, because otherwise you won't be getting the full picture. So the left-hand side, community levels that the CDC puts out primarily for the public, however weighted more towards hospitalizations. The right-hand side is geared towards high-risk settings, focuses on transmission. Transmission always precedes hospitalizations, better predictor of what's happening in your community. Take it with a grain of salt because we know that the rates are actually higher than what shows up in the map. So this is the background information. I'm going to simplify this all at the very end with some key messages that I want you to take away. But I'm just we're giving you this as background. So now in California, what you'll see here on the right-hand side is, so test positivity is almost up to 11%. So that's getting very high. We have a lot of risk in the community right now for transmission of COVID. And of course, the cases are going up as well. So you can see that here in our summary that we have from our state dashboard. Now, the way California has decided to really manage the COVID infection is really through the California Smarter Plan. So you'll hear a lot of us talking about the Smarter Plan. What's good about the Smarter Plan, it was designed really in such a way that it really incorporates our thinking and strategy around other respiratory viruses, because we know that, for example, in winter, the risk is high for COVID, but we know other viruses are circulating. And I'll show you a little bit later, all of these really come together to not just only disrupt our health, but also to impact our healthcare system. So the Smarter Plan stands for, S stands for shots, M for mask, A for awareness, R for readiness, T for testing, E for education, which is our school system, and RX for treatment. I'm going to touch upon some of these, go into a little bit more detail, and just know that this is our general approach that we're taking, and it incorporates our thinking about other respiratory viruses that are transmitted more or less in the same way as COVID. This is a slide from CMS that just has deaths and cases from nursing homes. So nursing homes, you can imagine really as being our highest risk setting, where you have much more older adults with pre-existing conditions that put them at higher risk for COVID. So you can see that over time we have made a big improvement. So if you look at January 2020, you see there we had a lot of cases, of course, a lot of transmission, and we had a lot of deaths. That's the orange line. Come over to April 2022, a lot of transmission. That big peak is the Omicron peak, but look at the number of deaths. By then, now that's the reason that peak is much smaller than before is really having to do with vaccine and us recognizing the air that Omicron continues to cause a lot of transmission, but fortunately the death rates are much lower. And we want to keep it this way. This is one population that we focus on because we know that that's one end of the spectrum in terms of risk and morbidity and mortality. So I'm going to show you a little bit of that data just because it gives you an idea of how we're doing here in California. So this is now comparing nursing homes across the country. You can see there for residents who have completed their primary series is about almost 89%. That's okay. That's good. That's good. The challenge is that we now know that you need boosters. And so when you look at boosters, it's going to go down. So here is now looking at the data of being up to date. That means that if you qualify for a booster, have you gotten a booster? It's not as good. It's 47%. So a key message here, based on what I just showed you in terms of the data, is stay up to date. Stay up to date with your boosters. It absolutely makes a difference. It's so critical, so critical. This is now for staff. You see this, the staff are 95%. And one of the reasons why California is so high is because we have requirements for vaccinations. And here it is for being up to date. So we're at 53%. We have a requirement that people get boosted once, but we really want people to be up to date. So that even though the requirement only requires you to have your primary and your initial booster, that's required. The truth is that we really want you to be up to date. That means that we want you to go ahead and get another booster. The one that's available now is the bivalent booster if you haven't had it. Okay, I'm going to talk a little bit about, and this applies to all respiratory viruses, especially for COVID. So for COVID, this virus is airborne. That means that it lingers in the air and it concentrates in the air, especially if you're in settings that do not have good ventilation, do not have good air filtration. And so this is probably one of the biggest challenges that we have. And the thing is that you cannot see it. In other words, you can have an infected person in the room, that person leaves the room, other people come in the room and they can get infected. It doesn't matter if the person's not in the room. It's not about how close you are to the person. It's how much virus is concentrated in the air. So the way to think about it is think about smoke. If you're in a room and somebody's smoking across the room, guess what? You can smell that smoke. If you can smell that smoke, that means you're breathing air that was close to that person. Now, if you're next to that person, you're going to get exposed to a higher concentration of that smoke. That's exactly the way COVID is transmitted. People who are closer to that person, if that person's not wearing a mask, that person is putting out more aerosols. People closer to that person are more likely to get infected. People farther away are less likely to get infected because there's some dilution effect. But at the end of the day, if that isn't being diluted, opening the windows, keeping the doors open, making sure that people are wearing masks so they're not, if a person's infected and asymptomatic. The other challenge that we have, this is also true for influenza, people become infectious before they develop symptoms. And for COVID, at least 2 days before you develop symptoms, you are really highly infectious. And most people don't even develop symptoms. So that means the vast majority of transmission is happening with people at the time they do not have symptoms. And that's why when you wear a mask, you're not just protecting yourself, but you're also protecting others because you might have COVID. You might have been infected at a recent event that you attended. You feel perfectly fine, and you don't realize that you're putting out a lot of virus. And by wearing a mask in a higher risk setting, you're protecting those other folks as well. So this is really an important thing to really understand. And it applies to, if you focus on COVID, it will take care of all the other viruses because COVID is the most infectious. So if you can reduce your risk of COVID, you reduce your risk of transmitting and acquiring other respiratory viruses like influenza and RSV that are less infectious, but nevertheless can make you ill. And this is just a reminder to think about the facilities that you work in, and to really think like when I go into a room I always think, okay, are they leaving the door open? Yes, leave the door open, let some air go, let some fresh air in. You know, oftentimes people we're in the habit of just closing everybody in to trying to make the environment more intimate. I would say keep the doors open, and you know what? Let the air, let the whatever's in the air, let it dilute. There's a researcher who says when you think about water, when we think about pathogens in the water, we think about the concentration of pathogens in water. And what do? We decrease the concentration of pathogens in the water through disinfection, like chlorine. So they say, well, if we do it for water, how come we don't do it for air? And it's absolutely true. We want to think that way. We do want to decrease the concentration of pathogens in the air. And it's actually good. It's actually in general good for all our health, because there's other things that concentrate in the air as well, especially in a lot of these buildings that are so airtight, and you have things that are coming off, other things that are concentrating in buildings that having to do with chemicals. This is the usual curve that people show about the variants. So we continue to have the Omicron variant, and now we have these subvariants. And the subvariant that's now circulating throughout the United States and in California is what's called this BQ1 and BQ11. It's a subvariant of the Omicron. It is just as infectious, super infectious, with more immune evasion. But we're going to have to see how this plays out. The vaccines were designed to take care of the Omicron variant, so we expect good coverage with the subvariants like BQ1 and BQ11. Okay, so why do I'm going to give you a little bit of background, a little bit about why it's important to understand of how these viruses work. So in general, if I'm a virus, I'm thinking to myself, what do I want to do? I want to infect somebody, so I want to be more transmissible. Okay, it's going to evolve it's because it's mutating. The strains that get selected are going to be those that have an advantage in terms of being more transmissible. So we get variants that are now more transmissible. In general, a virus says to itself, well, you know what? I want to make people sick, but I don't want to make them too sick, because if they get too sick, they're going to stay home or they're going to die, and they're not going to be out transmitting the virus. So they don't want to make people too sick. So in general, that's true for most viruses. That's not true for COVID. Why is that? Because COVID is transmitted primarily when people are asymptomatic. So the virus COVID does not care if it makes you sick. It does not care if it kills you, because it already has transmitted itself primarily through people who do not have symptoms. So that's actually not good news for us, because that means there's always a possibility that we can have a new variant that emerges that has more disease severity. We saw that already with the Alpha variant and then the Delta variant that they cause more severe disease. With Omicron, fortunately, it's not causing more severe disease, but it is super infectious. So, and it infects so many people. So that's how people end up in the hospital. Not because it's only because it just infects so many people that a fraction of those end up in the hospital, and our hospital systems end up being overwhelmed. So I just mentioned a little bit now about the virus. I talked about intrinsic transmissibility, immune escape. We're seeing that with Omicron. It wants to get around the defenses that we put up. Virulence means how sick it makes you. So I just finished talking about that. Now, us as the host, what are the challenges that we have? Well, we have waning immunity. Your immunity wanes whether you were vaccinated or whether you recovered from an infection. Social behaviors, we're spending a lot more time, we're going back to indoor activity, spending time with loved ones, attending big events, basketball games, things like that, which is, by the way, really important. So it's really important for us as humans to really be connecting socially. That increases the risk. It's a trade-off, but I'm just letting you know that that's just one of the things that impacts risk. The environment that you're in, is it an indoor setting? Is it a place that's well ventilated? And then what measures do you take to reduce the risk? Wearing a mask, ventilating the place, having an air cleaner. My wife is a school teacher. You know, last year she was in a classroom with first graders every single day. And in the room, she had an air cleaner to be cleaning the air, because she had a room packed of kids whom I'm confident some fraction of had COVID when they were in the classroom. Okay, so this here shows you hospitalizations. And this is one of the things that I want you to but people don't realize is that, so that red curve, those red curves are the proportion of people who test positive for COVID. The top line is the total census for a hospital. And you can see that the total census is over 100% in the Bay Area, in Sacramento, in San Joaquin Valley, and in Southern California. And if you look at the right bottom curve, that's for all of California, you can see that we're over 100% census. So what is this to say is that the hospitals right now are super, super busy, especially right now. The kids are being impacted, but it also impacts adult care. When the hospitals get so full, it impacts our ability to access care for other conditions that you have. Might be a stroke, a heart attack. It becomes very difficult because their capacity is full. It's hard to transfer patients to other hospitals because everybody's full. On that bottom right hand, you'll see it's red. That's COVID. You see blue? That's influenza. So right now in California, COVID is going up and influenza is going up. RSV, we don't have as good data. That in general might be leveling off right now, peaking a little bit in general. But right now, for the things that we're able to measure and do things about, it's those two. Okay, let me keep going. I'm gonna go a little faster because I'm gonna try to end. This here is just to remind folks that it's not one thing. One thing and it's one intervention by itself is not sufficient. Each one is not perfect. It's putting these together that makes the difference. Okay, I wanted just to let people know the other thing that we're concerned about is long COVID. So a small percentage of people who become infected, even if you have mild infection, can go on to develop long COVID. And long COVID, I'm going to skip to this slide here, is long COVID can impact your cardiovascular system as well as your neurological system. So it can make people hypercoagulable, so you can have heart attacks, you can have strokes, we have people who have brain fog. And the more severe disease that you have, the more likely you are to develop long COVID. And long COVID can occur anywhere within the first year after having been infected. So you can have a heart attack a year later that's related to the COVID that you had a year ago. Does that make sense? This is really important for people to realize because they think, oh, I recover from COVID, and a year down the line, they have a heart attack. And it's the COVID because this virus attacks many different organ systems, and it impacts us in a very profound way. And this is really important. This is another reason why you do not want to get infected. Okay, I'm going to be wrapping up here. This is actually a slide to give a little bit of optimism. This is the cumulative death rate. Remember I showed you the first slide where the United States had the highest cumulative death rate? Well, this is now the cumulative death rate comparing California to the most populous states in the country. And you can see that California is doing better. That's fantastic. And this is really, we have to give thanks and gratitude to really all Californians, everybody, providers, people like you who are taking care of folks and have come together. So this is really a community effort of us really slowing down transmission, and it had a big impact because when we delayed transmission, that bought us time to learn about how the virus is transmitted, bought us time to develop vaccines, bought us time to develop good treatment. So all these things help save lives. So that's why our cumulative mortality in California is less than other states. And this is true even after you adjust for age as well. We still end up doing better. So this is fantastic. Okay, we're going down to the last few slides. This curve here, I pulled down from the CDC today. You'll see here, it is risk for COVID infection, hospitalization, and death by age group. You see cases in the first row, hospitalizations in the second row, death in the fourth row. Now, if you let's just look at death. If you go across, you'll see the reference group is 18 to 29-year-olds. So if you are 40 to 49-year-old, you're 10 times more likely compared to somebody who's 18 to 29-year-old, 10 times more likely to die of COVID. If you're 50 years old, you're 25 times more likely. Keep going up. If you're going all the way up into the 60s, 70s, and 80s, you see 80s, you're 340 times more likely to die. This is one of the bottom lines that I want to emphasize to you. The strongest predictor of having a poor outcome, and this is true for COVID and influenza, is your age. Even if you're healthy, your age is the strongest predictor. That's why in California, we're encouraging people, everyone who tests positive should be evaluated whether you need treatment or not. And in California, we recommend if you're 50 years or older, you should absolutely get treated for COVID. And of course, if you have other medical conditions, that increases your risk too. Absolutely. But age is the biggest predictor. Super important to know. Let's just end up now. Here are 5 tips. Number 1, get vaccinated, stay up to date, and if you test positive, please get treated. Really, really important. Have a treatment plan. You should already be talking to your primary care doctor. There should be a note, and you should already know, your doctor should already know if you test positive, whether you're going to get treatment. Have it in your treatment, have a treatment plan ahead of time to facilitate making sure you get on treatment, because you have to get started within 5 days. Stay home if you're sick. Test for COVID. If you're positive, get evaluated for treatment, activate that treatment plan. Wear a mask. When I say wear a mask, what I really mean is wear a good mask, a mask that has good fit infiltration. The best ones are going to be N95s. That's what we really mean. That's what we want you. Of course, washing your hands, that's always true, especially with things like RSV, which can be transmitted a lot through contaminated surfaces. And of course, cover your cough. And what's the easiest way to cover your cough? Is to wear a mask. So on our website, we have some recommendations for how to look at how to adjust wearing a mask, whether depending on the community levels. You can take a look at this. In general, the way that I want you to think about it is that if you have the higher the risk, take precautions. Take precautions the higher the risk. And what is the highest risk? Age. So if you're older, you should be taking precautions. So if I'm in a public, I'm 63 years old. When I get on an airplane, if I'm in public transportation, when I go to the grocery stores, I always have an N95. That's what I wear. I don't care what anybody else thinks about me. I want to protect myself against infection. I want to protect myself against long COVID. I want to protect my wife and coworkers, and I want to protect myself. And so that's what I do. And so that way, when I do get together with my family, where we try to reduce the risk. We're not wearing masks. It's for those special moments where we want to be able to not have masks because we've reduced the risk. And so this is a way to really think about it. So I'm going to end there, and there might be time for a few questions, or I think we're running over. Thank you.
Thank you, Dr. Aragón. That was very, very valuable information. And I know it's a lot of information and tough to get in such a short amount of time. We are up on time, so I don't think we have time for Q&A, but thank you for all that have submitted some questions through the Q&A chat. If you do have additional questions, we welcome you to send it to us directly, and we'll get those routed and answered. You can send it directly to communications@aging.ca.gov. Just really quickly before we wrap the call, I know we're up on time and some folks have already left, but we'll also send out another email with all these resources and all the links and information, and also the slide deck as well. We'll share that out. I wanted to go over really quickly with you guys our outreach toolkit that we have. So I'll just share my screen really quickly so I can show you where you can find it on our website. Let me get the right screen here. Oops, okay, you can see my screen. If you go to Department of Aging, aging.ca.gov, if you scroll down to under highlights, you'll see it says Outreach Toolkit, RSV, flu, and COVID-19 impacts on older adults. If you click here, you will see that we have a toolkit that has social media posts. If you click on here, you'll see there's images and some suggested language that you can utilize. We also have some information if you send out newsletter articles or resources that you want to be able to send out to those that you serve. So there's some information here and also additional resources. And also here's a link to a radio spot that we just created. It's a 15-second spot. So if you do run your own ad campaign as well, you can use that 15-second. You can add your own 15 and make a 30-second if you run 30-second spot. So there's flexibility with that spot as well. And also there's additional resources here as well for vaccinations. We've had some direct mail pieces that have gone out. All these are free to request. If you click on each one, you can see that you can download the file if you'd like to print it. Some of them are available, you can order and you can distribute them as well. Same with our aging resource guide. This is available in English, Chinese, Vietnamese, Korean, and also Spanish. These are also available where you can view online and you can also order them if you'd like to distribute these guides as well. Again, we'd like to thank everyone today for joining us. We know we're a little over on time, but we'll send an email out with all these resource links, all the information that we've shared today. Thank you to our speaker, Dr. Tomás Aragón. Thank you very much for the information. It's been very valuable to our community. And thank you, Susan, as well. Again, this whole everything has been recorded today, so it'll be up on CDA's YouTube channel. We'll send out all the resource links to everyone that has attended today. So thank you very much and have a nice Friday and hope everybody enjoys your weekend. Thank you for joining us. Bye-bye.